And that whole narrative of estrogen causes breast cancer is simply not true. And in fact, breast cancer, when we look at it closely, is not a disease of hormone excess. It's a disease of hormone deficiency.
Welcome to Ending Chronic Disease, where we challenge everything you thought you knew about health. Join international best-selling author and wellness pioneer, Dr. Fabrizio Mancini, as he reveals how to transform your body, your mind, and your life starting today.
Hi, this is Dr. Fab Mancini, and I'm super excited that you decided to join us because today we have an amazing guest and somebody that's really taught me so much about women's health and especially integrative breast cancer and how to manage that properly. And that is the world-renowned integrative oncologist, Dr. Jenn Simmons. Hi, Jenn. It's so great to see you once again.
Fab, it's so nice to see you. I'm spoiled. I get to see you so much lately.
I know. And
I'm going to get used to it.
I'm so excited because, I admire so much anytime that you have individuals like you that have been trained traditionally in the healthcare system as a medical doctor. And you were one of the first Philadelphia's fellowship training breast surgeon.
Mm-hmm.
And then I heard you walked away from that to build Real Health MD, especially after your own crisis. So tell me a little bit about how does somebody like you, which is the elite in the medical profession, has an experience and all of a sudden realizes, you know what, this is a defining moment in my life, and practicing the same way that I've been trained just doesn't make any sense anymore. Tell me a little bit about what happened.
Well, you really have to have your earth shatter, right, to make that kind of leap because, quite frankly, surgeons are the top of the food chain.
Yeah.
And had I not gotten sick, there's no way I would have ever left. There's no way I would have looked outside of my tiny ecosystem, because why would I? Why would I ever think that what I was taught in medical school wasn't true? Why would I ever think that what I was taught in residency was wrong? Why would I ever think that what I was taught in fellowship were lies? Right? I would never think that. Why would I think that? Why would anyone think that? So, I come to the breast cancer space very organically. I grew up in a breast cancer family. My first cousin was a woman named Linda Creed. She was a singer-songwriter in the 1970s and 1980s. She wrote all the music for the Spinners and the Stylistics. She was beautiful, brilliant, larger than life. Her most famous song was The Greatest Love of All. So she wrote that song as the title track to the movie The Greatest, but it actually received its acclaim because it was Whitney Houston's greatest hit. And she released that song in 1986, and I'm a 16-year-old in high school, and my cousin writes the greatest hit ever, right? And it spends 14 weeks at the top of the charts. Only my cousin Linda doesn't know, because she died of metastatic breast cancer 1 month after Whitney released the song. So I'm 16 years old and my hero dies. And her life and ultimately her death gives birth to my life's purpose, because I never want another woman, another family, another community to have to suffer the way that mine suffered. So I do the only thing I know how to do, right? I go to medical school. I become a surgeon. I become the first fellowship-trained breast surgeon in Philadelphia, the first oncoplastic surgeon in Pennsylvania. And I do this really well and for a really long time, long enough for my aunt to be diagnosed, long enough for my mother to be diagnosed. And then at 46, it's my turn. And I'm sitting there in the office of my friend and colleague and physician, and he tells me that I need surgery and chemo and radiation and things that I say all day without hesitation or reservation. And yet, when these words are coming at you, it has different meaning. And I'm now asking all the questions that everyone was asking me, but suddenly the answers aren't working, right? Hearing that it's multifactorial, or there's nothing that you could do, or there's nothing that you can do, and you have to just hand over your health and your trust to the system. And I didn't want to. That was really the first time in my life where I ever said, wait, I need to understand why this is happening, and I need to have a role in it. I can't just go under the knife, take the drug, have the radiation. I can't do that. I need to actively participate in this. I need to understand it. And so I go on a journey to heal myself. This wasn't about like pulling back the curtain and exposing what's wrong with our medical system. I didn't learn that till later. I didn't learn that till I started to walk this path and walk this journey. And one of the first lectures I found myself in, this tall, lanky guy walks on stage and he has a big toothy grin. He introduces himself as a functional medicine physician. Now, at this point, I'm a doctor for 20 years. I never heard of a functional medicine physician. All I can think of is like, what is this quack talking about, right? Because despite the fact that I'm sick, I'm still cynical. And then I remembered that I was there for a reason, right? And that the only thing that I could hear in that time and space when I was given my diagnosis, when I was told that this is what I need, the only thing that I could hear in that time and space is there's something more, go find it. And this is a voice that I couldn't quiet. And it didn't quiet until I arrived in that room on that day, because what I would learn on that day from Dr. Mark Hyman is that in all chronic disease, but cancer in particular, since that's what I was most concerned about, we're doing it wrong. We're getting it wrong. We're focused on the wrong thing. We're focused on the tumor, but the tumor is not the problem. The tumor is the symptom of the problem. And unless you back up 10 or 20 steps and figure out why the symptom is there, why the tumor is there, you're missing the forest for the trees. And so as a surgeon, me removing tumors and saying to these people, like, that's it, go back to doing what you were doing, go back to your normal. Well, your normal is what got you there. And we are so highly trained as conventional physicians to not ask the questions, and that's very intentional. But I didn't learn that until it was about me. It was only when it was about me that I could take off those blinders and start asking the questions. Is how we're treating cancer correct? And the answer is no. And why are we treating it that way? Well, we're treating it that way because we want to get people into the system and keep them in the system. And the whole goal of our system is to get sick and stay sick. Now, they don't want you to die, but they also don't want you to be well, right? It is this system that is built on getting people sick and keeping them sick. And it took me getting sick to learn that.
You know, it's interesting because when I hear you talk like that, it makes me realize that you, for so many years, were just repeating what you were trained to do. You were doing the surgeries that you were trained to do, and that's all we know. And it's not until you open yourself to say, is there something more out there, that little voice that spoke to you? And it allowed you to all of a sudden begin to ask new questions and get different answers than the ones that you have been feeding yourself and being trained all those years as a traditional physician.
Yeah. Now, I don't want to say that there is no place for conventional medical treatment, right? Like, if you break a hip, you want an orthopedic surgeon to put you back together. If you have a ruptured appendix or a ruptured gallbladder, you want a surgeon to remove those organs and help you to get well. And there are even times with cancer where some of the conventional treatments are necessary, right? If you have a significant tumor burden, your proverbial sink is overflowing. It is very important to mop up the floor. Surgery, chemo, radiation, this is mopping up the floor. At the same time, if you don't turn that faucet off, you can't mop that floor forever, right? Yeah. And so for me, bringing in the integrative piece, or however you want to talk about it, I generally say we're bringing functional medicine into it, because what everyone gets when they get a cancer diagnosis, they all get a treatment plan. But what they all need is a health plan.
Yeah.
And that's where I see it now. And I'm no longer operating. I haven't operated since 2019. This is not to say that I don't send people for surgery. I do. This is not to say that I don't send people for chemotherapy. I do. But we do it better. We prepare people for surgery. We prepare them for chemotherapy. You know, one of the most impressive things that we've learned in the last 5 or 10 years is that if you fast while you get chemotherapy, it's more efficacious. There's less side effects. And yet, in the majority of chemotherapy suites around this country, what are they doing? They're feeding them while they're getting chemotherapy. They're giving them Ensure and Boost. Their medical oncologists are saying, no matter what you do, don't lose weight. Well, most of the disease in this society, as you very well know, and breast cancer is included in that, is due to lifestyle factors. The majority of them are due to being overweight. Most women with a breast cancer diagnosis are overweight, and they desperately need not to be, because they're so metabolically shifted in the bad direction, right? And you know, it all comes back to what we have is a sick care system. And all we do is rinse and repeat. We're training the same people to think the same way to get people into our sick care system and not have them be healthy, because our system doesn't work with people healthy. The only way doctors get paid, the only way hospitals get paid is if you're sick. They're not getting paid if you're well.
Well, you know, being in this space for 38 years and watching the evolution of wellness, complementary medicine, functional medicine, integrative medicine, regenerative medicine, all of this evolution, for me, the blessing in disguise is that it opens up the opportunity to see a more holistic approach as an initial support, and then never discarding the fact that, thank God that we have the more aggressive conventional approach if needed. But we have found over the years that even if you choose the conventional approach, and say in this case chemotherapy or radiation, there are ways to prepare, like you mentioned, or there are ways to actually reduce the symptoms by feeding the body the right things, not the sugars and the carbohydrates and all that you see a lot of times, unfortunately, as people are doing chemo. But let's talk a little bit about mammograms, because you've been very outspoken about the limitations and potential ones, you know? Well, I think it's important because this has been traditionally the main tool to diagnose.
Yes, for more than 50 years.
You've been in this space. You have been able to see also its own limitations, especially as you've gotten more into the functional aspect of the body being able to heal. And what are some of the new sciences that you discover in this journey? For those that are skeptics out there and may not be hearing what we're about to discuss, and why is it that you may want to reconsider a different technology instead of your traditional mammography, which is what everybody recommends?
You know, if you ask even a breast radiologist to be honest and say, is mammogram a good tool? They would absolutely, if they were being intellectually honest, they would say no. But the problem is, they're so ingrained in this system. Now, in 1971, was it the best that we had? Yes. Have we known since 1978 that mammograms don't save lives? Yes, we have. But we didn't have anything else. And people want to screen, right? And we were fed this narrative that mammograms save lives, and no one asked the question, wait, is that really true? And when we have asked the question and have looked at the data, and the data has been looked at, so you know, hundreds of thousands of women have been studied, and the conclusions are all the same. Mammograms do not save lives, and when you use mammogram to screen, you are going to both create some disease because it is radiation, and you are going to create a phenomenon called overdiagnosis, where a certain percentage of women diagnosed every single year with breast cancer would not be diagnosed with breast cancer but for the fact that they had a mammogram, that these people would have remained clinically negative in that they would have never developed clinical disease. They would have never developed a lump. They would have never needed to be treated, right? But because we are using this very, very inferior technology, we are both causing disease and we are overdiagnosing. So I was especially excited a few years ago when I was introduced to QT. This is something that was invented by a gentleman named Dr. John Klock. He also invented the cardiac calcium score, the CT colonoscopy. He has many, many inventions under his belt. But this was born out of the fact that MRI, which is being used as the gold standard screening tool for women with dense breasts, is expensive, it's cumbersome, it uses gadolinium, so it's dangerous, and it's just not an adequate tool for screening. We know that mammogram is not an adequate tool for screening women with dense breasts. It will miss 40% of cancers in women with dense breasts, and for every 1,000 women that you screen, you're going to call 100 back with false positives and unnecessary biopsies. And those numbers are just not, it's not appropriate. It's not appropriate to punish 10% of the population unnecessarily because we've hitched our wagon to this inferior technology. So what QT uses is sound waves, and it's transmitted through a water bath. So it's basically like a spa day for your breast, where your breast is immersed in warm water. The sound waves are completely silent, but they're circumferential. It collects 200,000 times more data points than MRI and creates a true 3D reconstruction of the breast. It's 100% safe. It's 100% painless. There's no compression. There's no radiation. And we are able to do what's called volumetric measuring, where if we see something in the breast, we can bring someone back for a short interval study. So instead of biopsying them, we can bring them back in 60, 90 days, remeasure the volume, and get a doubling time. So we know, is this an active process or is this not an active process? Because sometimes, even if it's a cancer, if it's not an active process, we don't need to do anything about it. The body is taking care of it. And we can focus on what's important. What you and I know is important is, are you eating in a way that's nourishing? Are you prioritizing movement and sleep? Are you avoiding toxins, especially alcohol? Are you drinking clean water? Are you managing stress? Or do you have a breathing practice, a meditation practice? Are you living in a connected way? Do you have joy in your life? Because we know that this is what drives health. And focusing on disease is just going to get you disease. So I don't think anyone should be screening with mammogram. I don't think that we should be exposing the screening population, which is the normal healthy population. I don't think that we should be exposing them to radiation. I especially can't stand the argument that it's just a little bit of radiation. well, how do you feel about taking a little bit of poison, right? Do you want a little bit of poison or no poison? Or the other argument that is made even by radiologists that, well, it's the same amount of radiation as you would get in a cross-country flight, and you wouldn't tell someone to not fly cross-country, right? Well, that may be true if you're talking about absolutes, but you're not talking about the scattered radiation that you get on a flight. You're talking about focused, cone-down radiation to the tissues of the breast. Not the same, all right? My knucklehead of a 16-year-old knows, not the same. It's different, right? And we need to start acknowledging that. We need to stop treating patients like dummies. They know. And 35% of women are opting out of getting screening mammogram because they know. So even if the radiologists want to continue on and continue to hitch their wagon to this very, very broken technology, we are still not serving 35% of the screening population if that's all we're offering them. So I'm very excited about QT. I opened a center featuring QT. It's called Perfection Imaging, but perfection is spelled with QT in the middle. And I'm opening 50 of these because I want to make sure that every single woman who wants access to this technology gets access to this technology.
Well, from a preventative basis, for those that are listening right now, what is the ideal scenario now that we have a radiation-free, compression-free, 3D acoustic ultrasound, much safer technology?
Yes.
What would you say from a preventative basis? Because remember, we in the functional space, we go after the root causes. So the earlier sometimes that we find out, the better. What is a typical recommendation in your life as a physician for those individuals out there that maybe they may have a history, maybe they don't have a history in their family of breast cancer, but they want to ensure that they are keeping themselves aware of how healthy they may be? What's your typical recommendation?
No, it's an excellent question. And I do want to stress that imaging is always going to be early diagnosis. It's not going to be preventative. And prevention, as you mentioned, and rightly so, is far more important, right? We always want to prevent more than we want to treat or reverse, right? Early detection is good, but by the time you've developed the disease and by the time we can detect it on imaging, we're talking about hundreds of millions to billions of cells, right? Like is it the horse is out of the barn the horse is out of the proverbial barn. So I always want to talk about prevention. And for me, there is a brilliant new test that's out there that is considered an at-home breast cancer screening tool. It's called the ARIA test or the TEARS test. And it is actually looking at the fluid in your eye. You don't have to make yourself cry or poke yourself in the eye or anything like that. It's a little tiny litmus paper that goes right beneath your lid. And it's measuring for these two proteins, the S100A8 and S100A9 protein. Now, these are inflammatory proteins that are very commonly seen, but when they're both elevated together, they are highly predictive of the early stages of breast cancer, way before you can see it on imaging. So for someone that has a clinically positive ARIA test, what they have is opportunity. They have the opportunity to actually prevent a diagnosis because those people know that they have inflammation. Now, inflammation is our buzzword, right? We want to know that we are not inflamed because inflammation is the precursor to all of these chronic diseases that we are all helping to fight every single day. And breast cancer is no different. So I encourage people to do the ARIA test twice a year so that you know. And if you have a clinically positive ARIA test, then you're looking at, I have developed something called the breast cancer burden score, or the breast burden score, where you're looking at all of these factors and saying, where's my inflammation coming from? Am I eating processed foods? Am I not sleeping well? Do I have chronic constipation? Am I drinking alcohol? Do I have too much EMF exposure? How much antibiotics are you taking? How much antibiotics are you exposed to? What about pesticides, herbicides, fungicides? What about plastics? What kind of water are you drinking? Are you getting enough rest? Are you exercising too much? Are you exercising too little? I could go on and on. There's a lot of things on that list, but I'm helping people with a positive ARIA to think through this, and they become part of my prevention program, where I have a breast cancer prevention program, because we know you're at risk. And this is different than having relatives with breast cancer, or even having a genetic mutation. This is a real biological risk right now, and we can help prevent a diagnosis with that. And we just work with people to find where their inflammation is coming from and help them to create an anti-inflammatory environment in, on, and around them.
You know, you recently had your 100th episode of your very famous podcast, where you talked a little bit about the role of many of the survivors that you've interviewed, and also where bioidentical hormones may play a role. What would you say to those individuals? What has been your findings, but also what message will you give those oncologists out there that are still stuck with the old way of thinking, that you want them to rethink, perhaps based on your experience?
Yeah, so that whole narrative that estrogen causes breast cancer it's logical and it's convenient, and it actually leads to a plethora of solutions that can be provided by the pharmaceutical industry. It just doesn't happen to be true, right? God would never give us hormones that cause breast cancer. That's just not how it works. We are perfect beings and living in a very imperfect world. And that whole narrative of estrogen causes breast cancer is simply not true. And in fact, breast cancer, when we look at it closely, is not a disease of hormone excess. It's a disease of hormone deficiency. And you think about what happens to the female body as opposed to what happens to the male body, because men do go through what we call andropause, but they go through andropause in a very kind of steady, slow decline, whereas women, especially those treated for breast cancer, fall off a cliff. They go from having a body that works to nothing's working. And historically, because we've had this whole narrative of hormones cause breast cancer, which was only reinforced by a very, very flawed NIH study. So now we have decades of providers who have come up in a system believing that hormones are a problem and not a solution. They're not educated on hormones. And it's become a taboo thing for anyone with a history of breast cancer. They're told that they can't have hormones, and it's the wrong message and the wrong answer. And the truth is that it's very much a part of health and a necessary part of health.
Yeah, and we've been trained to understand the role of the hormones, but unfortunately, most people, they're not. So they're just listening to whoever they're going to. And I've always say to them, look, it's okay to receive an opinion for whoever provider you may be seeing today. But if for some reason that opinion does not make sense, or it doesn't resonate with you, or it just flat out doesn't make any sense, go seek out a different opinion, because we have now individuals like you that have been trained traditionally, but have also advanced their studies into the functional space to give people maybe a deeper insight. But let's talk about your new book, this Smart Woman's Guide to Breast Cancer, promises to free you from your diagnosis. Now, in this book, what I love about it is the fact that you made it very practical for people to follow a roadmap and to understand and ask the right questions. But what would you say are maybe 2 myths that you see out there in social media that are keeping a lot of these women stuck to the old beliefs?
Well, I think the biggest thing is the fear, right? And so they capitalize on the fear to get people into treatment ASAP, right? They make it like it's an emergency. And I understand that breast cancer feels like an emotional emergency, and maybe it is, right? But what you need if you're having an emotional emergency is a hug. What you don't need is a surgery, right? And so one of the biggest myths is that you have to take care of this right away. Most people have time. Most people have an excessive amount of time. You have months to decide, right? But the system really doesn't want you to. The system doesn't want you to look too deeply into these things, right? And so we tend to ask the same person the same question, and so we get the same answer, and we think that we got a second opinion. You talk about this all the time. If you think you're getting a second opinion from another person that does the exact same thing that you asked the first person, that's not a second opinion, right? They're all going to give you the same answer. That's what they're trained to do. So the first thing that I tell people is that you have time to learn about your diagnosis, time to understand it, time to understand all the treatments, the conventional ones, and what we would call the holistic treatments, right? And the second thing is that you are an individual. You got to that place for your own individual reasons. Breast cancer is not one disease. It's not, and it also doesn't define you. It's not who you are. So many people come to me and they're so focused on their pathology report, like it's who they are. That's not who you are. It may be something that you're dealing with right now, but it's not who you are, right? And so really looking at the why, what got you here? Because something has to change. We can't expect a different outcome if all we're doing is the same thing that we were doing before. So I don't want people going back to normal, right? They're going to have to find a new normal if they want their life to be better after their diagnosis than it was before. And the people that I work with, you may think of them as exceptional in that they have very different outcomes than most people going through a breast cancer journey. But the truth is that they have very different outcomes because they live very different lives after their diagnosis than they did before. And this is an opportunity for people who choose to take on this responsibility. This is an opportunity to really be better afterwards. And my people are healthier after their diagnosis than they ever were before. And it's not that it's so hard to do. It's just that they didn't know to do it. We are not taught how to be healthy. We're only taught how to be sick.
And the thing is that because most people follow the same healthcare system, not only here in this country, even though we keep hearing we're one of the sickest nations in the world, but it's all over the world. And one of the things I love about this book is not necessarily when you've been diagnosed. I believe this book is about somebody that wants to prevent a diagnosis. Because
Absolutely.
When you said a smart woman is somebody that is proactive, not reactive. It's that simple to me. And then the guide is the fact that you go through what are the right questions to be asked and how to understand what this really is instead of this urgency that you feel that sometimes is overwhelming. And then if you talk to your friends, they don't know what to tell you. So most of them just want to give you pity and and feel bad for you and try to...
Or push you into treatment because it's the only thing that they know and understand.
Yeah, and it may be because they care about you and they think that is maybe the right thing to do. But in closing, I wanted to ask you this because you're very much a leader in this space, and you have been a pioneer, in my opinion, in awakening society towards this issue and being more proactive than ever. But let's say all of a sudden you have the opportunity to make a recommendation for future guidelines potentially, or even policies that are made in order for women in the healthcare system to be given an opportunity to learn early, but more importantly, educate them properly towards how to manage this disease if it ever shows up, or how to prevent it from ever showing up. Do you have any ideas of what contributions or what recommendations you will make, the administration to consider in this process?
Yeah, so I would absolutely love to take over breast cancer screening. I'll tell you that right now. Where in my system, I would have everyone doing self-breast examination because I think that no one is ever going to know you better than you know yourself.
And how early would you start that?
I mean, I think that women, when they start to menstruate, they should start to learn what their breasts feel like and what their body feels like. The patient is absolutely the doctor of the future, right? No one is ever going to know you better than you know yourself. And we all have to take responsibility for our own health because no one is going to do it for us. And even if they do, they're not going to do it as well as we can. Now, that is not to say that everyone has to take responsibility in total for their own health. No, of course not. But you should know your body and know what it feels like when it's normal so you can know what it feels like when it's not, and not allow the medical profession to normalize things, right? Oh, you're just getting older. Oh, you're just tired because of this or that. Like, no, we can feel good forever, right? But you have to understand your own body and recognize when there's been a shift so that you can go get help to get that shift to come back. So I believe in self-breast examination. I also believe that tests like the ARIA test are going to be the determining factor in who does and who does not need imaging. Because unless you have a positive ARIA test, the likelihood that you have breast cancer is almost nothing. So it has a 93% sensitivity for breast cancer, which is better than any of the other tests that are out there, with the exception of MRI, which is too sensitive and leads to a lot of false positives. So I believe that the ARIA test is going to be the determining factor for who does and who does not get breast imaging. And then beyond there, I think we need to stop lying to people about our food pyramid, about what is food, what is proper lifestyle. We are literally killing our people with the diet, with our work life, with our stress, with the EMF, with the toxins, with what's in our water. Like, we are literally killing our people. And so we really ought to, we need to trash the system and start over. And we need to start over with people who know how to build health and not just create disease and extend disease and manage symptoms. So I do believe that everything needs to change. In the meantime, I want to save women from unnecessary radiation, unnecessary biopsies, unnecessary diagnoses. And, when you diagnose a woman with breast cancer, you will forever change her life, and not in a good way. Not in a good way. And all of our treatments for breast cancer lead to more disease. They lead to more morbidity. They lead to more mortality. They increase heart disease. They increase neurodegenerative disease. They increase osteoporosis. These are the three main threats to a woman's life, and we are causing them in the breast cancer population. And the facts are that we are overdiagnosing 20 to 30% of breast cancers a year. So if we diagnose 300,000 women in 2024 with breast cancer, it means that 60 to 90,000 women got that diagnosis unnecessarily. And the treatments for breast cancer are not benign. We are hurting people, and that needs to stop. So, if I was given a soapbox and a platform to stand on, that would absolutely be my platform. Is I want to change screening. I want to change the way that people live their life. And then when women go through menopause, because the truth is that most women will live past the time when her ovaries have shut down, we need to support these women. Now, hormones aren't the be-all, end-all, right? They're the bow on top of the box, and the box is filled with all of those foundational things that you and I talk about every single day. But there is no clean diet, there is no supplement, there is no detox that is going to substitute for estrogen and progesterone and testosterone and DHEA. I'm sorry, there just isn't. I know that there are a lot of people out there, influencers out there, even providers out there saying, this supplement will do it and that this diet will do it. It's simply not true. And it is necessary and it is safe when done correctly and thoughtfully. And if we decided tomorrow that hormone replacement is good for everyone, we simply do not have the providers who are literate and trained in this area, and that needs to change. We need to educate our providers about hormones, about hormone safety, about safe delivery systems, and we need to support our women.
Well, and to me, as all of that is happening, and I see, the good news is that I have seen with my own eyes over the last few years how more and more medical doctors are getting additional training, additional masters or certifications that are teaching them some of these processes that have been around, and also the science behind it. And for those of you that are listening, the main thing that I also want to impress upon you is the fact that, just like Dr. Jenn mentioned earlier, you are your best doctor, and you should actually take the opportunity to ask the questions. Now, in my opinion, you have probably one of the best books written on this subject matter right here that you can just easily go to Amazon and get it, or you can go to Dr. Jenn's website, and I'm going to put all of this information right here, so you just click and be able to get it yourself. But also, I would encourage you to listen to her podcast. Her podcast has amazing guests, but also the informations are very real. There's no hold bars, there's no pretensions.
There's a lot of takeaways every week.
And I love that, because I've seen that that's really how people learn today. You have to be authentic, and you can't just keep repeating the same things that everybody already knows. You have to really bring in some new insights into the conversation to allow you to have a different outcome. So make sure that you follow her podcast. And I'm going to put her link here. Please, if you have not given yourself the opportunity to experience the technology with the QT imaging, please do so. You can go to her office in Philadelphia and do it there, and she can guide you as to if there's any other facilities that are available. I was so excited when you told me the other day that you were expanding this concept so people can actually have it in their own backyard, and hopefully they'll take advantage of that. But don't wait. Just take a quick flight, be able to get a comprehensive evaluation, and most importantly, be proactive. Be proactive by beginning to shift your thinking and start asking different questions, but also learn about the subject matter. Go beyond your typical opinions that you're getting out there, and understand that it's not anyone's fault. It's just the way the system is, because that's the way it's been for a while. But it doesn't have to be your system. I stepped away from that system 38 years ago because of an insight that I realized that I'd rather live my life preventing disease than managing symptoms. It was that simple for me. And it made me have a radical decision not to go to medical school and become a neurosurgeon, but also become a chiropractor, acupuncturist, and nutritionist, and energy medicine expert. All the things that I became only because I'm hungry. I'm hungry for answers that have not been given to the masses of people. And I'm also hungry for better outcomes. We live in a system that our outcomes are terrible.
Terrible.
Not solving our problems. And this is one that now you have an opportunity to, in my opinion, have a better chance to manage it better, and more importantly, to be proactive and never have to deal with it, because there's no better way of doing that than to really be preventive. Any last minute words, anything that you would like to leave our audience with?
Well, first of all, it was such a pleasure to be with you here today. And I love what you're doing and your whole perspective. And I do see a future for all of us where we are biohacking and we are all about preventative medicine. And it will happen. The thing that you said about being curious, I think that that's what sets that whole functional medicine mindset apart, is that we are approaching everything with curiosity and wondering every day, how can we do this better? And unfortunately, conventional medicine is kind of stuck in, oh, this is how we do it. And so, for any of you out there who are in that world, if you're just a little bit curious, there is so much training out there for you, and it is tremendously rewarding. So, and for the person who's looking for more help and your doctor says no, or that's impossible, go ask someone else. Go ask someone else with different training that question and see if you can get a better answer, because I think health is possible for everyone at any age and any stage. And there are really, really trusted guides out there. You just need to find one.
Well, thank you so much for your time from your very, very busy schedule. And for those of you that are listening, thank you for taking the time to be with us. Please share this with your loved ones, somebody out there that may be praying or hoping for this type of information right for them. You may not even be aware that they're struggling with something. So share it with as many people as you can, and continue to join us as we continue to bring to you all this innovative information that will hopefully allow you to make a better choice when it comes to your health today than you did yesterday. God bless you, and I'll see you soon. Thank you.
To learn more about Dr. Fabrizio Mancini's groundbreaking work, visit www.endingchronicdisease.com and join the movement. Together, we can end the silent epidemic of chronic disease and create a healthier, more vibrant world. Thank you for tuning in. Until next time, be well and stay inspired.